Welcome to We're on ECMO, a series for the ECMO community. I've got a very special guest with me today. That is Kathie Posa-Kearney. She is a clinical nurse specialist in the CVICU at Rush University Medical Center. She is a 2024 Illinois Nurses Foundation 40 Under 40 Emerging Nurse Leaders awardee, recognized for her leadership in critical care and nurse education. Since transitioning from the bedside ICU nurse to CNS in 2019, Kathie has led the development of Rush's adult critical care residency program, blending evidence-based training with wellness support to prepare and retain new graduate nurses. And most recently, she presented at NTI with her session Go Big and Go Home, How to Drive High Quality Outcomes in Awake ECMO Program. Thanks so much for joining us, Kathie.
Yeah, well, thank you so much, Neil, for having me and for that wonderful introduction.
Of course, of course.
Um, it's
Lots of
been a
good
very
things. There's probably
interesting,
more I could say,
yeah, it's
but
been
I
a
just want
real
to jump into
interesting
it
first five
and
years of my career.
get to the meat for folks to listen and to learn from you and your experience. And so, can you tell us a little bit about your unit at Rush and the types of patients that you typically see?
Sure. So we are a 28 bed ICU that sees a mixture of cardiac surgery, ECMO patients. That's where the ECMO patients come in, open heart surgery, and then the other half of our patient population is cardiac medicine, where we see cardiogenic shock, advanced heart failure. We have an LVAD program that's emerging that kind of restarted in the fall of 2019.
Hmm.
And so those patients kind of float back and forth between the two services. But so it's a mixture, all cardiac, lots of devices, every type of mechanical circulatory support you can put a patient on.
Hmm.
We do that. The only thing we don't do is we are not a transplant center.
Gotcha. Gotcha. Sounds fun, adventurous for sure. Lots
Yep.
going on. So you've got all these patients, and so we're really here today to talk a little bit about mobilization and verticalization. Like, what is the approach or philosophy when it comes to mobilizing ECMO patients?
Yeah, so that is something that I'm very happy that ELSO has recently come out and supported the mobilization, really heavy in their new mobilization and rehab protocol that they released in January of 2025. But we've been mobilizing ECMO patients for about 10 years.
Nice.
And I firmly believe that has a lot to do with our survival and our disposition outcomes
Mhm.
in sending people home and having a good quality of life.
Absolutely. Absolutely. Speaking of those ELSO guidelines, how have they influenced your patient care or practices?
Well, I don't want to sound conceited, I guess, but I don't know if they had a ton of influence on our practice, except for just providing additional evidence to
Sure.
any people that may be new to the team
Yeah.
to say, I've never done this before. But the walking of ECMO and the mobilizing of ECMO patients, we've had ingrained in our practice since, starting in 2015, really, really honed in 2018, and
Hmm.
then just skyrocketed through the pandemic.
No, that's great. That's great. Um, uh, what are the biggest challenges that you face when mobilizing ECMO patients?
I mean, patient acuity, obviously one that
Mhm.
you want to make sure that it's the right time for the patient to be mobilized. It is a slow progression. It doesn't happen overnight. I think that is a mindset that we really have to hone in to the nursing staff to not give up. They don't do well one day standing at the side of the bed. We try again either later that day or the next day to where we're giving those patients constant chances
Hmm.
to mobilize and really just work it into the everyday practice.
Great. At NTI, you shared how your team incorporated verticalization therapy using the Catalyst bed into your ECMO program. How did that initiative start, and what made the adoption successful for your unit?
Yeah. I would say the adoption being successful was just time and like perseverance.
Hmm.
And getting those small wins. So having patients placed on the bed and then over time, staff and providers and physical therapists seeing the benefits of having them in the bed when they couldn't walk and how that advanced their mobility even quicker when they could get to a place where they could walk.
Hmm.
So I think overall, like the message that I want people to know is that it is not an overnight process. This,
Hmm.
as I've stated, like we started in 2015, which was before I even was there.
Hmm.
And it's been a decade plus long process of getting those patients up and moving and having it be part of the everyday life.
Gotcha. How is that the catalyst bed, the verticalization used currently, like in that daily practice of like
Yeah.
just kind of doing a little bit at a time and keeping on, like you're talking about?
Yeah, so it is part of our process to place a ECMO patient on that bed within the first 12 to 48 hours of them being cannulated. And that really is dependent on patient stability,
Sure.
because we want them to be using the bed, not just
Hmm.
putting it under them and then they're not utilizing it. So there is a level of stability that the patient needs to have. But then it's just slow progress. And they start with a session in the morning and see how they do, even if that's like a 10-degree tilt, and how long the patient can handle that hemodynamically. We have a great team of physical therapists, bedside nurses, and ECMO specialists who are all comfortable with this type of therapy. So they're comfortable with the patient not looking great in
Hmm.
terms of knowing that they're fully supported by ECMO.
Right.
So we have a little bit more leeway than if you were to put a patient who was not supported by ECMO on a Craig bed to verticalize them. We have a little bit more leeway.
Sure.
So,
Yeah, a lot of it's right, that just that education and
yep,
experience, you know,
exposure. Yes,
yeah.
and the culture that is ingrained now, where we've been doing this for such a long time, they know our outcomes are good. They know that verticalization, along with progressive mobility, is attributing to those outcomes. So they
Mhm.
believe in it. And I think that's a huge factor.
Yeah. I think one of the things that our team notices a lot when we're working with people that come to our collaborative care and mobilization courses is that there's that fear factor. And
Mm.
once people kind of get that experience and kind of learn that it doesn't have to be scary, obviously there's a need to be a very aware
Yes,
and everything,
there's
but
a
that,
little fear is
yeah, a
okay.
little bit, a little bit.
It is still
But
very
yeah,
scary.
absolutely, absolutely. But good to see that culture that you guys have developed just kind of continues to trend even when you bring those new folks in.
Mhm.
Obviously, there's a lot of patients that you guys see in your unit. Do you see patient populations outside of ECMO that would benefit from verticalization therapy?
Yeah. The clinical nurse specialist team in our critical care department has been attempting over the last, I don't know, 2 or 3 years to really expand that population of who would benefit for this bed, because all ICU patients would benefit from progressive early mobility. And some of those patients can't start by sitting at the side of the bed,
Hmm.
whether that is acuity wise, whether it's device wise. I'm thinking of even my own like balloon pump patients where they
Hmm.
have, cannulas in places that limit their mobility. So we have expanded to the other three adult ICUs with the use of the Catalyst bed. I will say nothing is ingrained yet. That culture shift hasn't gone completely to that side.
Hmm.
But it's a work in progress. And like I said, it took us a decade to do it with ECMO patients.
Right.
So we're just continuing to get feedback from staff and providers on what patients would benefit, who should we start with, and just take it one day at a time.
Absolutely. Um, so soon, in the near future, we're going to reconnect again for a time to highlight Russia's Catalyst implementation, some clinical outcomes and strategies for partnering with vendors as clinical collaborators. As that is upcoming, is there anything you'd like to preview or share with us for folks who might attend that webinar in the near future?
Yeah, I mean, I think that it would be beneficial for those programs who are interested in, including mobility based on those ELSO guidelines, but don't really know where to start, don't know, the tools that they need, the team members that are helpful. And that's all that I have in that presentation is what it takes to build the ECMO program that we have built, from the team members to the patient selection, and then the equipment that we use to assist in mobilizing them.
All right, that's awesome. Well, I'm really looking forward to that. Hopefully, if you're watching this, you'll make plans to check out that webinar coming soon. Thank you again for joining us. If you're watching today and you have questions that you'd like to see answered by an expert, please email me, Neil, Neil at ecmoadvantage.com. Thanks.
Thank you so much.